As we age, our bodies change. We might not move as quickly and our balance might not be what it used to be. This can make falls more likely. But falls are not a normal part of aging. We can take steps to prevent them and stay safe. Falls can cause serious injuries like broken bones and head injuries. These injuries can make it hard to do the things we love. They can even lead to a loss of independence. That's why it's so important to talk about fall prevention. Whether you're concerned about yourself or a loved one, this guide will give you practical tips to stay safe and independent. Remember, a few simple changes can make a big difference. Let's work together to prevent falls and live our lives to the fullest. Falls are a serious public health concern, especially for older adults. The numbers tell a compelling story. 1 in 4 Americans aged 65 and older falls each year. Every 20 minutes, an older adult dies from a fall. Falls are the leading cause of fatal injury and trauma-related hospital admissions among older adults. These statistics highlight the urgent need for fall prevention measures. By understanding the risks and taking proactive steps, we can significantly reduce the incidence of falls and their devastating consequences. Remember, these numbers represent real people, our parents, grandparents, neighbors, and friends. Let's work together to keep ourselves and our loved ones safe. Our homes should be our sanctuaries, places where we feel safe and secure. But for seniors and those with mobility issues, even seemingly harmless household features can pose fall risks. The good news is that many of these hazards can be easily addressed with simple modifications. Remove tripping hazards by securing loose rugs with double-sided tape or non-slip pads. Keep walkways clear of clutter, electrical cords, and low-lying furniture. Coil or tape down cords that cannot be moved. Improve lighting by ensuring adequate lighting throughout your home, especially in hallways, stairways, and bathrooms. Use nightlights in bedrooms, hallways, and bathrooms to illuminate paths at night. Add handrails and grab bars by installing handrails on both sides of stairways, and grab bars in bathrooms, especially near toilets and showers. These provide stability and support when getting up or down. Use non-slip mats by placing them in bathtubs, showers, and on slippery floors. These provide traction and reduce the risk of slipping, especially on wet surfaces. You might be surprised to learn that your footwear plays a crucial role in preventing falls. Wearing the right shoes can significantly improve your balance and stability, reducing your risk of slips and trips. Choose supportive, non-slip footwear with low heels, good arch support, and non-slip soles. Avoid wearing slippers, flip-flops, or shoes with worn-out soles, especially on stairs. Ensure a snug fit by making sure your shoes fit properly and provide good ankle support. Loose or ill-fitting footwear can increase your risk of tripping. Consider non-slip socks if you prefer wearing socks around the house. Choose non-slip socks with grips on the soles. These provide extra traction on smooth floors. Remember, your feet are your foundation. Wearing proper footwear is a simple yet effective way to enhance your stability and reduce your risk of falls. Section 5. Simple exercises for enhanced balance and strength. Regular exercise is essential for maintaining strength, flexibility, and balance, all of which are crucial for preventing falls. You don't need a gym membership or fancy equipment to reap the benefits of exercise. Here are a few simple exercises you can do at home. Heel-to-toe walk. Walk heel to toe in a straight line, placing one foot directly in front of the other. Start by standing tall with your feet together. Step forward with your right foot, placing the heel directly in front of the toes of your left foot. Then, step forward with your left foot, placing the heel directly in front of the toes of your right foot. Continue this pattern for 10-20 steps. This helps improve balance and coordination. Chair squats. Stand with your feet shoulder-width apart, facing away from a sturdy chair. Slowly lower yourself as if you're going to sit down, but stop just before your buttocks touch the chair. Keep your back straight and your knees over your ankles. Engage your core muscles as you lower yourself. Then slowly rise back up to a standing position by pushing through your heels. This strengthens leg muscles essential for stability. Ankle circles. Sit in a chair with your feet flat on the floor. Lift one foot slightly off the ground and rotate your ankle in a circular motion, first clockwise, then counterclockwise. Repeat with the other foot. This improves ankle flexibility and range of motion. Single leg balance. Stand with your feet hip-width apart, holding onto a sturdy chair or countertop for support. Slowly lift one foot off the ground, bending your knee slightly. Hold for a few seconds, then lower your foot back down. Repeat with the other leg. This strengthens leg muscles and improves balance. Section 6. Emergency preparedness, a vital safety net. While we strive to prevent falls, it's also essential to be prepared for emergencies. Knowing what to do in case of a fall can minimize potential injuries and ensure timely medical attention. Keep your phone nearby. Always carry a cell phone or keep a phone within easy reach, especially if you live alone. This allows you to call for help immediately in case of a fall. Consider an emergency alert device. These devices, worn as a pendant or wristband, allow you to call for help with the push of a button. They provide peace of mind, especially for seniors living alone. Inform family or neighbors. Let your family or neighbors know if you're concerned about falling. Provide them with a spare key and ask them to check on you periodically. Know your medical information. Keep a list of your medications, allergies, and emergency contacts readily accessible. This information is crucial for first responders in case of an emergency. Section 7. Tips for caregivers. Promoting safety and independence. Caregivers play a vital role in preventing falls and ensuring the safety and well-being of their loved ones. Here are some tips for caregivers. Conduct regular safety checks. Regularly assess the home environment for potential hazards and make necessary modifications. Pay attention to lighting, clutter, and tripping hazards. Encourage daily routines. Establish consistent daily routines for activities like bathing, dressing, and medication management. This promotes independence and reduces the risk of falls during transitions. Promote balance exercises. Encourage your loved one to engage in regular balance exercises, such as those mentioned earlier. These exercises can significantly improve stability and reduce fall risk. Be patient and understanding. Remember that aging can be a challenging process. Be patient and understanding with your loved one, and offer encouragement and support as they navigate these changes. Section 8. Open communication addressing concerns and seeking solutions. Open communication is crucial for addressing fall risks and finding effective solutions. Encourage your loved ones to share any concerns they may have about falling or feeling unsteady. Listen attentively and validate their feelings. Initiate conversations. Don't wait for your loved one to bring up the topic of falls. Initiate conversations about fall prevention and express your concerns in a caring and supportive manner. Ask open-ended questions. Instead of asking yes or no questions, ask open-ended questions that encourage your loved one to share their thoughts and feelings. For example, instead of asking, "Are you worried about falling?" ask, "How do you feel about your balance these days?" Seek professional help. If you're concerned about your loved one's fall risk, don't hesitate to seek professional help. A doctor or physical therapist can assess their balance, gait, and overall health, and recommend appropriate interventions. Remember, open communication fosters trust and empowers individuals to take an active role in their health and well-being. Section 9. Assistive devices, enhancing mobility and confidence. Assistive devices can significantly improve mobility, independence, and safety for seniors and those with mobility issues. These devices provide support and stability, reducing the risk of falls and enhancing confidence. Canes and walkers. Canes and walkers provide additional support while walking, reducing strain on joints and improving balance. Choose a device that's the right height and weight for the individual. Wheelchairs and scooters. For individuals with limited mobility, wheelchairs and scooters can provide greater independence and freedom of movement. These devices are particularly helpful for longer distances or outings. Stair lifts. Stair lifts are motorized chairs that travel along a track installed on a staircase. They provide a safe and convenient way for individuals with mobility issues to navigate stairs. Bathroom aids, grab bars, shower chairs, and raised toilet seats can make bathrooms safer and more accessible for seniors and those with mobility issues. Section 10. Medication management, minimizing risks and side effects. Certain medications or combinations of medications can increase the risk of falls. It's essential to review medications regularly with a doctor or pharmacist to identify potential risks and explore alternatives. Some medications can cause side effects such as dizziness, drowsiness, or blurred vision, which can increase fall risk. Be aware of potential side effects and discuss any concerns with your doctor. Taking multiple medications can lead to drug interactions, some of which can increase fall risk. Inform your doctor or pharmacist of all medications you're taking, including over-the-counter medications and supplements. Schedule regular medication reviews with your doctor or pharmacist to ensure your medications are still appropriate and necessary. They can also identify potential drug interactions or side effects. Always take medications as prescribed by your doctor. Avoid crushing, splitting, or chewing medications unless specifically instructed to do so. Section 11. Regular health checkups, early detection and intervention. Regular health checkups are essential for maintaining overall health and well-being, and they can also play a crucial role in fall prevention. During these checkups, doctors can identify potential risk factors for falls and recommend appropriate interventions. Vision and hearing impairments can significantly increase fall risk. Regular vision and hearing tests can detect these issues early on, allowing for timely treatment and corrective measures. High blood pressure and high blood sugar can contribute to dizziness and balance problems, increasing fall risk. Regular monitoring of these conditions is essential for managing risk factors. Osteoporosis, a condition that weakens bones, increases the risk of fractures from falls. Bone density screening can detect osteoporosis early on, allowing for treatment to strengthen bones and reduce fracture risk. As mentioned earlier, certain medications and supplements can increase fall risk. Regular reviews with a doctor or pharmacist can identify potential risks and explore alternatives. Section 12. Embracing a proactive approach to fall prevention. Preventing falls is an ongoing process that requires a proactive approach. By incorporating fall prevention strategies into our daily lives, we can significantly reduce our risk of falls and maintain our independence and well-being. Engage in regular physical activity to maintain strength, flexibility, and balance. Choose activities you enjoy and that fit your fitness level. Don't try to change everything at once. Start by making small, gradual changes to your home environment, footwear, and lifestyle. Acknowledge and celebrate your progress, no matter how small. Every step you take towards fall prevention is a step in the right direction. If you're struggling to make changes or feel overwhelmed, don't hesitate to ask for help from family, friends, or healthcare professionals. Section 13. Conclusion: small changes, big impact. Preventing falls is not about living in fear or restricting our lives. It's about taking proactive steps to ensure our safety and well-being. By implementing the tips and strategies outlined in this guide, we can create safer environments for ourselves and our loved ones, reducing the risk of falls and their potentially devastating consequences. Remember, even small changes can make a big difference. Whether it's removing tripping hazards from our homes, choosing supportive footwear, engaging in regular exercise, or simply being more mindful of our surroundings, every effort we make contributes to our overall safety and well-being. Let's embrace a proactive approach to fall prevention, empowering ourselves and our loved ones to live life to the fullest, with confidence and peace of mind.